Hi, this is Vonda. I'm with KVP International.
And I'm Tess.
And we're here to show you some of the Balto braces today. So the Balto Life is going to be a lift support product as well as a compression brace for those patients with hip dysplasia. One caution that I give to pet parents and to the veterinarians is if you have a more progressed or an older patient who's been dealing with hip dysplasia for quite a while, please radiograph them first, because one of the things we're going to do is we're actually going to compress that hip joint back into place. So as we know with hip dysplasia, we have a laxity with the femoral head and the acetabulum. So this brace is designed to have the hind legs go through the holes. They're able to void with this if we have a male patient, so don't worry about issues with that. We have compression disc here. These are removable. And I'm going to show you with these here in just a few minutes how we figure out exactly where we're going to have the placement of this. So during first fitting on a patient, you want to help with placement of the disc and have somebody else pull the rest of the brace up over the hip of the patient. Again, we'll demonstrate shortly. You do have removable straps because you're going to be able to use this as a lift support agent too. So when we talk about hip dysplasia with these dogs, we have a couple of surgical options that may be the best product or the best outcome for your patient working with your DVM. Could be a total hip replacement, might be an FHO. So during a femoral head osteotomy, we actually remove the femoral head from that part of the joint. So this product is one that you can use prior to surgery to give them support, and then after surgery you're actually going to take the disc off the brace and use it as a lift support during recovery. Finding the right fit when you start the compression part of this brace. You have your disc that is going to Velcro into the life brace itself. So how do we know where to place that? When you're standing with your dog, you can palpate their hip and you can find the point of the hip. The point of the hip is someplace that every pet parent and DVM can find. That is where you're going to center this disc. So when you center that disc there and then you pull the rest of the life brace up and attach it to the Velcro, by securing the straps up over the hips of your patient, you're actually going to compress that joint back into place. That does a couple of things for you. You're going to reduce inflammation, you're going to increase blood flow, and give them the support they need so that they have better mobility. So during application of the life brace, you want to grab an extra pair of hands, either a technician in the clinic or a family member at home. Again, you're going to palpate for that point of the hip, the greater trochanter, so you can center the disc. You're going to have your patient standing in the brace and then help lift it up to secure that Velcro, and then you're going to secure the Velcro straps up over the hips. And this is what is going to give you that nice compression into the hip joint to reduce inflammation, increase blood flow, and give your patient the support that they need as they deal with hip dysplasia or recovery after surgery. If needed, we do have the removable straps. So these straps turn this brace not only into a compression brace, but as a lift harness.
Now, how do I know what size to order for my dog?
So on our website on kvportho.com, we have measurement charts. For the Balto Life, you want to get a measurement of the upper thigh, and that's going to help you decide which size to order.
What do I do if the size is too big or too small?
So we run into that sometimes with the Balto braces. If you are in between sizes, if you're between say a medium and a large, go ahead and order the medium. That way we get a little bit more of a snug fit, especially since this is a compression brace.
So what age are these braces, or any braces really, recommended for use?
So the age in which you want to start using, say, the Balto Life brace for hip dysplasia is really going to be variable depending on the severity of the hip dysplasia for your patient. Working with your DVM, always refer back to them. They're going to have the best recommendation for your pet.
Can this brace be used in place of surgery?
While surgery might be the absolute best option for your patient with hip dysplasia, it really depends on what you're handling. If we're looking at a total hip replacement or an FHO procedure for your pet, you may want to use this while you save up the funds needed for that surgery, and that's when you're going to use those discs in the life brace for the compression factor. And then after surgery, if surgery is definitely the best fit, take the disc out and this becomes your lift harness for recovery.
So how long should I leave this brace on my pet throughout the day? And can they also sleep in it?
So So we don't recommend that they sleep in the brace. You can leave it on for upwards of 12 hours. However, we don't suggest that you start there. With all of our Balto braces, you want to start with 30 minutes the first day, move up to an hour, and then up to 12 hours on and 12 hours off, because we still want the skin and coat to have a break and be able to breathe.
Can I leave my dog alone wearing this brace?
We don't typically recommend that you leave them alone while wearing this brace. However, if they need to be unsupervised for a short period of time, we recommend pairing with one of our preferred e-collars.
How long should it take for my dog to be able to adapt to this brace?
So it usually takes the average patient between a week and 2 weeks to adapt fully to the brace, because of course this is going to feel strange to them. When you are fitting them and you first want to make sure that they are mobile with this brace along with many others, take them outside to some grass or a gravelly area where they're encouraged to walk and move with the brace. But that's why sometimes we want to apply it a little bit looser the first couple of days so they just get used to the idea of having it on.
Are these braces able to get wet as well?
Yes, so you're fine if you need to take them outside to use the restroom and it's raining. You're just going to hang it up to dry. And then of course, if you need to wash it, then you're going to remove the disc from the brace, cold wash, hand wash, and hang to dry. So we have a bonus tip for you for the Balto Life brace. One of the things you can do to assist your patient with comfort is you can take these discs, they're going to sit on the greater trochanter, right on the point of the hip, and you can actually freeze these. So that you freeze these overnight, and then when you apply it the next day for the first 20 minutes, you actually have a cold compress on your patient.